Good morning, everyone, and welcome to day 2 of Beauty Uncovered Live. How are we all today? I can feel a lot of really good energy in the room. We have so much going on today, so I hope you have a brilliant morning and afternoon if you're sticking around for the whole day. My name is Shannon Kilgariff and I'm the editor of Beauty Uncovered magazine, and I'm going to be your host today for the Beauty Uncovered Live Arena. Today we have so much going on and so many exciting talks from some of the best practitioners in the industry, as well as some celebrity guests. So I'm really excited. We've got Sharon Gafka coming very soon from Love Island, talking all about her treatment journey. We also have the amazing Nadine Baggett, who is a renowned beauty journalist, and she'll be back with the Q&A later. And we have the 10 Years Younger in 10 Days team back again today, and they're going to be talking about the journey of the guests on the program with the fabulous Dr. Tapan Patel and the amazing Cherry Healy. So don't miss out on those. That's all here at the Beauty Uncovered Arena today. But I'm very delighted first up to welcome the Beauty Triangle. Francesca Ogmian-White is here, who's the founder of the Beauty Triangle and is Tatler's cosmetic surgery guide editor-at-large. So Francesca, I'm really delighted to pass over to you, and please join me in welcoming Francesca and our expert practitioners this morning. Thank you.
To you guys. Good morning, everyone. Hope you can hear me okay. Yeah, I can never hear up here on the stage if this is projecting or not. Good morning. It's so amazing to see so many new faces, familiar faces. Thank you for joining us at Beauty Uncovered Live. We're so excited to be here. So big thanks to the team for hosting us beautifully this morning. I'm Francesca Ogmian-White, and I'm the founder of the Beauty Triangle. Now, we're here this morning to go beyond aesthetics, because I think we can all agree in a space like this, aesthetic procedures have the most extraordinary power to change our external appearance. But what I think so often goes unsaid in our industry is the innate power that these treatments have to actually restore our self-esteem, rebuild broken bodies, and really rejuvenate us from the inside out. Now, when we first started the Beauty Triangle about 3 years ago, it was with this intention that we would educate and empower our consumer audiences, but also from a holistic standpoint. Hence, we always have 3 specialists on a panel, and each has their own specialism. So it very much is about 360-degree wellness. Another key point was that we were going to introduce you to the most expert practitioners out there, because there is a lot of misinformation in aesthetics, but I really believe that these are the women who you need to be speaking to get the best info. So on that note, it gives me great pleasure to introduce today's panel. We're joined by aesthetic doctor and founder of Aesthetics Clinic, Misharina Balaratnam. We're joined also by oculoplastic surgeon and founder of MZ Skin, Dr. Maryam Zamani. And finally, by the amazing Dr. Galyna Selezneva, who is an incredible body sculptor and psychiatrist. So they're an amazing trio, and really they're going to be helping us to explore the positive impact that the right procedure can bring, whether that's bringing a tired face back to life, or really just sort of helping us through those key milestones in life. A few things to mention: you'll have found some programs, some referral cards on your benches. The referral cards are just in case you'd like us to connect you with any doctor that you hear speak today. We'll do all of that after the talk, just so we can fast track you to getting your own sort of questions answered in the best possible way. We've also got a goodie bag for you, so please come up to stand G1 on the mezzanine after this to come and claim that. You don't want to miss it. It's got some amazing skincare, some vouchers, some goodies in there. And we also have time for a quick Q&A at the very end. So any questions, throw your hand up, and we'll try and do those at the end. That's enough from me. I'm going to hand over to the panel now, and then we'll get started with the conversation. So first up, Misharina Balaratnam. Thank you for joining us, Sherina.
Oh, it's an absolute pleasure, Francesca, and thank you so much for hosting this today. It's such an honor, ladies and gentlemen, to be here in front of all of you today for day 2 at Beauty Uncovered Live. And this is going to be a very exciting panel. My name is Misharina Balaratnam. I am a former NHS surgeon in plastic and reconstructive surgery in the NHS. I've been a doctor for 24 years, so 12 years in surgery. However, the last 12 years has been in complete non-invasive reconstructive medicine. I specialize in everything non-invasive for the skin, the face, the scalp, and the body. And I'm very excited to be here with Francesca and you all today. Thank you.
Thank you. Maryam, thanks so much for joining.
Thank you so much for having me. So again, I'm also very happy to be here on day 2 of Beauty Uncovered. I am an oculoplastic surgeon, which means that I focus on plastic surgery around the eyes and the eyebrows. I also have a special interest in facial aesthetics, so I do all the fun, non-invasive things like injectables, lasers, peels, and other treatment modalities. I'm also the founder of MZ Skin, which is now 5 years old, and most recently launched a new clinic. So very excited to be here. Thank you.
Thanks, Maryam. And Galena, thank you also.
My name is Galyna Selezneva, and I am an aesthetic doctor, and I work with Dr. Rita Rakers in Knightsbridge, and we specialize, I would say, in everything. We have a lot of machines. We have lots of machines for the body, the skin, the faces, oh God, probably everything. But I have to say, this conference is so different to everything, all the boring conference that we're used to, doctor to doctor, rather boring. So to see real patients and real people, that's what keeps us going. So thank you for coming.
It's so true. I love, the energy of having real patients and real consumers with us. It's such an amazing sort of experience to have in this space as well. So we'll get started with the main conversation. So first up, Miss Sherina Balaratnam, excuse me. She introduced herself, but she lectures globally on the most advanced facial aesthetics. And she also has a very high-tech, holistic sort of combination approach going on in her clinic, which I always find really fascinating. But maybe, Sherina, you can start by telling us, we're obviously seeing a huge increase in aesthetic procedures. So what would you say the current lifestyle factors that are really driving that demand for us to be optimizing our physical appearance are?
That's a fantastic question, Francesca. And when I reflect on my practice over the last 3 years, I think many of the lifestyle changes that have happened pre-pandemic and then going into the pandemic. We have to bring that up because that's a very significant impact that has happened to all of us throughout the entire planet. And then we need to think about post-pandemic and what those trends have actually impacted us for now.
Almost the coming out of hibernation after the pandemic.
Absolutely. So I just want to go back a little bit because it does influence me up my answer. Pre-pandemic, we were seeing a growth in aesthetic treatments. We were seeing a growth in demand already. We were seeing a growth in consumer interest, curiosity as well. But we were also seeing a growth in confusion. It's an absolute minefield, and many of you today have walked in and you've come into this beautiful space. It is beautifully done. And you're seeing topical therapies, you're seeing high-tech facials, you're seeing laser companies, you're being introduced to body sculpting procedures that my colleagues are going to mention to you about. So there's certainly a lot going on out there, and there's a lot that you can enjoy and learn to today. And then we went into the lockdown, and that had a significant impact as well because everything closed down, everything introverted. And let's think about what happened to all of us from a personal perspective and from a professional perspective. From a personal perspective, a lot of my patients went into how am I going to look after my family? How am I going to look after my children? How am I going to homeschool? So there was a lot of personal pressure that happened to a lot of people that I see. And a lot of people had to think about, okay, I now have to neglect myself for a little while because I have to cater to my family. So there was a lot of a giving culture. So a lot of my patients went into a neglect zone.
Exactly, and not sort of prioritizing their own self-care because they were so focused on looking after those others around them.
Absolutely, Francesca. So then let's look at the professional side of things. A lot of patients then went on to Zoom, into meetings, into Teams, things like that. So there was a focus suddenly into looking into screens for a prolonged period of time. A lot of patients of mine focus on careers that cater to different continents across the world as well. So you're then seeing Zoom calls happening in the morning, in the afternoon, the evening, and sometimes into the weird hours of the morning too. So you're seeing patients becoming increasingly more tired, presenting with different trends across the last 2 years. We call it the rise of the Zoom face, becoming more sedentary, that lockdown illness, becoming more sluggish, puffy eyes, sluggy skin, patients suddenly saying to us, I just don't feel like I'm looking into that Zoom lens and seeing myself anymore. And that brings into another topic, people finally seeing themselves for far too long, because we're normally used to just popping in and checking the mirror every now and then. But all of a sudden, that is all we're seeing ourselves, morning, noon, and night.
And never in the most flattering light either. I think it took a lot of us, and certainly myself, a long time to get a ring light. And that did make a difference, but I mean, honestly, it's a bit of a scary sight otherwise.
Absolutely. I mean, beyond one ring light, I've actually got 3 to try and illuminate myself from all angles, you know, and I think Zoom caught on to that very quickly, and I think they put on their own filter, and I didn't even know about that till last year. So some of the lifestyle influences actually happened during pandemic. Okay, so when patients suddenly came out of pandemic, they suddenly said, gosh, I was rushing to have treatments. I'm rushing because I suddenly look tired all the time. I don't feel the way I do. My skin has become sluggish. I've become sluggish. I've become more sedentary. My legs are puffy. I've put on a little bit of weight. When I think about the lifestyle influence 1 year ago, most of the average weight gain was about 4 to 5 kilos. But then let's fast track to now, coming out of all of that. And our patients are now more tired. They put on an average of 7 to 10 kilos, so a little bit more weight gain, a little bit more heaviness and sluggishness. So I go back as far as even looking at the lymphatic system for my patients, because I'm seeing a lot more lymphatic stasis. Patients may only present with one thing: I've got puffiness around my eyes, but that is, and you know, Dr. Maryam will say, that is the end point to say that the whole system in the body has completely changed.
Yeah, so true.
So I always look at the personal impact at home. Another thing that I've seen a lot of is what I call the sandwich generation. So this is a lot of patients in their maybe 50s or 60s that are now having to look after their elderly parents in their 80s and 90s.
Yep.
And so they're carers for their parents, and that sends that patient into a whole lot of accelerated aging patterns. Caring for a loved one causes a lot of stress impact in our lives. And then at the end of the spectrum, caring for the children as well. So this is what I call the sandwich generation. So consultation is key. Our mission is to listen and to always try and get an idea who that patient is in front of us, what they're going on in their lives, because often than not, we have to treat beyond the treatment, and we have to get into the holistic with a lot of the treatments that we do. So I call that the ultimate reset when someone comes and sees me.
I think, yeah, I always consider aesthetics as the place to go for the reset, and it's so true. And going back to what you said about accelerated aging, do you see certain chapters of life beyond what we're all experiencing sort of culturally, socially at the moment? Are there specific milestones in a man or a woman's life which also contribute to this accelerated aging?
Absolutely, all the time. I mean, we could speak about this all day, because we know that when we grow up, even if you divide us into the decades of our life, for the first 10 years of our life, we're sheltered. Mom and dad fortunately look after us, so they keep us clean, they keep us well and healthy, unless we're born with any congenital deficiencies. And then we head into our teens, and that's a significant impact. Male or female, we suddenly develop hormonal changes. Yep. So there's a hygiene impact on the skin. So we need to think about oil control, we need to think about cleanliness, and those impacts. And then we head into our 20s, and all of a sudden we start working, we start heading out, we start going on holidays, we start drinking, we start doing all these other lifestyle changes that happen to us. So our skin requirements need to be adjusted in order to meet the demands of what life is throwing at us. Even when we go into work, coming into London, cigarette smoking, alcohol consumption, pollution, little bits of pollution particles can get into the skin in the micropores and actually settle and cause something called inflammation. So in our 20s, because we're out and about, I see a lot more inflammation in the skin. So treatments like the hydrofacial, having a skin analysis are very, very important. And in our 20s and 30s, we suddenly start getting married, having children. So we're seeing big hormonal shifts in the body again, from the skin, the face, the scalp. And all of a sudden we start having children, so we slowly look after ourselves even less, because we're giving, we're suddenly becoming carers. So and we're seeing a sudden change between our 25s and 35s to 40, because we produce a lot in our youth. We produce new cells, we're capable of regenerating, we're capable of repairing mutations due to sun, sugar, stress, all of those things that cause accelerated aging. So our repair buttons are firing on a high, and we're able to multiply and divide and produce new cells throughout the entire body, inside and out. However, from about 25 to 35, the degree in which we produce collagen, elastin, hyaluronic acid, all those building blocks of the skin, they slowly decline 1% every year.
I always find that the most terrifying statistic.
And don't forget, you know, beyond the skin, we also then have to think about fat layers. We need to think about skeletal change. That is something we don't think about. I keep a skeleton in, well, not a real skeleton, but I keep a mock skeleton in my clinic to demonstrate to patients that beyond 35, we also start losing 1% of skeletal change. So we know that because when we look at granny and grandpa, they're a lot shorter than us, right? So we have to take all of these things into consideration. There's a girl out there going, oh no, into consideration when we think of reconstructing the skin, the subcutaneous fat, and the skeletal change.
And I think it's really interesting because you've sort of very much picked out the physicality of what changes. And I know from being a patient at your clinic as well, you're very concerned with restoring the energy of the patient that sort of is sat in front of you as well. And I think, again, going back to our subject, looking beyond aesthetics, you know, we need to restore the physical change, but we also need to replenish the emotional, energetic sort of deficiency. And what would you say when it comes to the in-clinic treatments that you perform are the ones that are really enhancing that energized appearance?
I think I would say it's the ones that I have personally. I moved out of London in 2013, and I've moved to a beautiful location called Beaconsfield in sunny Buckinghamshire. It's about 45 minutes from here, 35 minutes from train. And I wanted to create something beyond my NHS practice that was built for patients to come and learn, number one, because this is a new speciality, in my opinion, because although you see things that are very established, there are also many things that are brand new here. So when I came out of NHS reconstructive plastic surgery, I was brand new to this environment, just like you. So I wanted to bury myself in a clinic and bring everything brand new and to create it for me so that I can think about my aging, my longevity, for my family, for my friends, and for our patients to grow into it. So everything that I brought in has got medical grading with it, FDA clearances, what we call in Europe CE marked. Another thing I wanted to bring into also state-of-the-art technologies that we can trust, that we can believe in, and to get constant reproducible results every day. So when I think about the treatments that I have, they're actually all for me, and so therefore they will be for you.
I think it's often the best way, you know, for a doctor or a practitioner to almost use themselves as their own guinea pig, because if you feel safe enough to use something on yourself and you see the results, then obviously you want to share that with your patient group.
100%. Today's Mother's Day internationally, so I built the clinic for my mom. So anything that she can have in my practice, that's got to work for everybody, right? So when I think about the best treatments, I always think about great skin health. So I think about my lymphatic drainage. I think about my lymphostim.
I love that suit, the sort of body compression device.
So I go back to basics because without a healthy homeostatic within the body, we need to start from the beginning. I do this because we do that with all our patients. We reset. So I think about my lymphatic trousers. I think about my hydrofacial that I custom blend with another oxygen facial treatment. These are the treatments that I had on Wednesday before I came here.
This is why you're so glowing today.
we gotta go with it, you know. I think about my radio frequency skin tightening, because don't forget, from 25 to 35, I'm losing 1% of collagen every single year beyond 35. So I've got to think of things that are going to work with my own natural healing processes in my body to wake up my collagen again. So these are medically graded devices, radio frequency skin tightening, that I know because when I look at my imaging pictures from 2015 to now, although I've lost a bit of volume deficiency, I actually look healthier and I look better now than I did 7 years ago.
And I think that's the great thing about these imaging devices that you use as well. Your clinic does it so brilliantly, but it's so wonderful to have that benchmark, to actually see that progression. I think you often say that it's almost to enable your patients to celebrate their results as well.
Always. We have a rule. You know, it's all about patient education, it's all about patient results. And it should be every single day results that you can see, feel, track, measure, and celebrate. If we don't get all 5 ticks, then we're failed. So it has to be that. It has to be that predictable. Yeah. So I then think about the next acceleration of energy, because I always say aging is a loss of energy, and that's clinically proven. So from CT and MRI scans, we can see that we age in a skeletal way, in a fairly reproducible way from men and women across the decades. And then when we think about cell science, we actually know that ADP to ATP changes, which is the making of new energy, that process slows down in all of our cells. So we call that cell senescence, the waking up of cells. So think about your electric car analogy. You're going to get a brand new electric car. It's going to be fully charged up at home. And then you're going to take it on a long drive. Guess what? The energy is going to go down, right? So you need to plug it back again. Everyone's holding a mobile phone. You're not going to let it deplete at the end of the day. You're going to go home and charge it up, maybe even during the day. So there is a stand at the back called Saluma. And about 4 times a week, I now cover myself in that and switch it on, and I go to sleep underneath that.
And Saluma is the LED device, is that right?
It is an LED. So this is where light now comes into play to heal accelerated aging. And we're all accelerating because we're doing so much more every single day now. We're working harder. When I speak to patients, they say they're working 30% harder than they did a few years. Galena shaking her head, 30% harder than she did.
I think everyone is. You know, our working days, particularly if we're at home now, don't finish at 5:30 or 6 o'clock when we used to leave an office. We're now on our phones all the time, replying to emails at midnight, first thing in the morning when we wake up.
Correct. So for the high performance girl with high performance living, we got to think of high performance tech.
I love that you call this high performance living.
High performance, yeah. I have a huge amount of respect, you know. It's high performance living, but guess what? She's not going to stop. She wants to get up and go. So do I. So I use advances in technology like the Saluma wrapped around my head because I know, according to 7 FDA trials for pain management for my back and 3 for facial aesthetics, that's going to make me wake up because it's waking up my energy producing cells. And then I think that of the next treatments that wake up my cells, radio frequency skin tightening, I think of my M-Sculpt Neo for my body, and that, you know, Galena will talk to you about. It's delivering 20,000 super maximal contractions into my muscle groups in 9 different areas, and that makes me feel so much more alive when I have these sort of treatments. And beyond the aesthetic, it's also repairing things like muscle separation. It's repairing muscle wasting that comes from being sat down for 2 years as we're slouching into our chairs. So it's improving posture, it's improving rehabilitation. And when I think of our new devices now that I've brought in the last even 2 months, I think about rejuvenation using your own blood. So get healthier, everybody. Get more fit.
This is the PRP that you've introduced recently.
Absolutely. Platelet-rich plasma. So when you think about what you're doing, you're utilizing your own blood. It's called platelet-rich plasma. You're spinning it down in brand new centrifuge systems. These devices are getting better with the years as well. So I have a company called Regen Lab. We're using pure blood. We're now able to mix it with hyaluronic acid, which is the natural sugar in your own system. And it's almost as if you're combining your best blood with the best hyaluronic acid and putting it into your skin in half an hour and igniting it with fantastic LED technologies. So our treatments are getting faster because we have to keep in touch with the speed in which ladies and men like you lead your lives. So we have to develop techniques and treatments that are going to meet the demands of our patients.
And I think it's fantastic because a lot of the things you've spoken about are very regenerative as well, and I think that's what a lot of us are looking for. You know, we want to use our body's own natural resources to naturally energize and amplify our performance. I can't let you finish talking without speaking to you about injectables because you are fantastic. You know, you're one of the leading doctors in this country, I think, when it comes to Botox, to dermal fillers, and I think it's something that for a lot of patients, particularly when we're new to the field of aesthetics, specifically injectables, there can be a lot of fear around those, but I know from the work that I've seen you do, Sherina, that they can have a really energizing appearance to the facial structure. They can really undo a lot of the, you know, the age-related changes that you've been speaking about today. So how do you go about reassuring your patients of a very natural end result, one that still looks like them when they look in the mirror?
That's a wonderful question, and it's interesting that we've left injectables right to the end of this discussion, because for me,
the icing on the cake.
It's the icing on the cake. And I always say to everybody, you know, do nothing is always an option, which is why you're here, to learn, to understand, and also to understand the aging of your own face. There are 5 layers we've got to think about: the skin, the superficial fat, the muscular layer, the deep fat, and then finally you have your skeletal platform. So when I think about facial fillers, I have to think about all those layers that I have to build in order to restore the foundation of the house. So think about being an architect and think about building a property. You don't just put the roof on, you got to put the pylons underneath the template. And then you've got to put the foundations up, which are the walls. And then finally, you've got to make sure the brickwork in the walls is also supported. And then finally, you put on the roof and you furnish it really, really nicely. So all your work has to go unnoticed. So when I think about my filler work, I say to patients, come in and have a great consultation. I think that's really important. Have 2 great consultations. Take your time. I never see and treat on the same day because I can't know anything about anybody in just 10 or 15 minutes. So when I think about my filler work, I have an opportunity to consult my patients with imaging. So I use something called the Vectra 3D imaging during my consultations, so that beyond looking in a mirror at someone's face, I can actually show them by taking a 3D picture what they could potentially look like if we were to augment a temple, for example. I always start temporal augmentation because that immediately energizes and opens the eye. So Francesca talks about treatments that energize the face. That is that first injection point that makes the most impactful difference in energizing a face. I'm not looking at your lips, I'm not looking at your neck when I talk to you, I'm looking at your eyes.
And
so
the temples are so interesting because they're an area that none of us ever assume we're losing volume in.
Yes.
You know, it's such an insignificant sort of area on our faces. We zone in on the features so often, don't we? Not the periphery.
Never do. Whereas, everything that happens in our aging actually happens outside the zone in which we can see. So if you think about a facial plastic surgeon, they're never making the cut here or the cut in the jowls. The cut is always somewhere you cannot see. So the injection process is always in the same place. It's always up and out. So you almost have to take it like this thing, up and out. So when it comes back to my injections, I explain that to a patient by getting them to look in the mirror, and I do the same with my own face so they can appreciate and understand deep injection planes to support fat and muscle and bone, the lateral cheek to support fat and muscle and bone. And I want you all to do this to yourselves, and just do that with 3 fingers. Do you suddenly feel more open and awake? Does your face suddenly
100%.
feel different? Everyone's kind of like nodding. So what happens then is you're actually restoring tension and integrity into certain muscle groups, which is called the orbicularis muscle. So we call that tensegrity, tension and integrity. And when you do that to someone, you get someone suddenly saying, wow, I not only look more awake, but I actually feel more awake, because you're actually putting back something that the patient needs. And then let's continue it. Outer cheek, beyond the cheek. We call these CK zones, beauty coded zones. So I can go into a whole lecture about injection technique and even the jawline. So taking these 3 injection points and just doing that, automatically I feel so much better about myself. I use before and afters every single day. And I use before and afters in different patient groups, different age groups, different skin types, male and female. And I think it's important when you go for a consultation that you ask your practitioners, may I have a look at your work? It doesn't matter whether someone's early on in their career. We all started somewhere. But ask whether you can see some details about your work. And don't jump from practitioner to practitioner. Stay with one. We all get complications from time to time. And it's really important to ensure that you have your follow-up and you have your follow-through. So I use before and afters, I use clinical photography, I use 3D imaging, and then last but not least, I also use my amazing team to talk to my patients as well. And that's really important. Ask to talk to other patients, ask to talk to other people, ask to talk to your friends, your doctors, and I think you should be able to see good quality work. This is the place where social media has taken over as well. It's an opportunity to learn. So please do follow my page. There are a lot of images there that you can learn from. There are lots of things that we all do on YouTube as well to educate our own audience. So there's a lot to be available if you follow all of us.
I think that's a fantastic note to end on, Sherina. Thank you so much. And I think, again, sort of really emphasizing the importance of education and self-education as well, which I think we're in the right space to be talking about that today. So thank you so much, Ms. Sherina Balaratnam.
Thank you, Francesca.
Next up is the amazing Dr. Maryam Zamani, who she introduced herself earlier. She's an oculoplastic surgeon. She has her own amazing clinic on the King's Road. You must visit it. It's the most beautiful space. And then she's also the founder of MZ Skin, which is also a fantastic line of skincare. But Maryam, maybe we can start by sort of talking about the effect of the eyes, because they're often the first sort of port of call when we sort of see those initial signs of aging, aren't they? But what would you say are the most common complaints that bring patients to your door, eye-related?
So I would say most people who come in to see me usually complain about looking tired. So being fatigued is usually when they look in the mirror, and as we just heard and we've seen for ourselves with lots of video conferencing and actually just even social media, we're always looking at ourselves a lot more than, getting ready in the morning or that occasional bathroom break or something like that. So people complain about looking tired, and as we know, we also always look at people's faces. We look at their eyes before we look anywhere else. The majority of our effort and our attention is focused on the eye area when we speak and interact with people.
It is our main sort of form of communication, that eye contact,
it is.
Isn't it?
You can see so much emotion, happiness, sadness.
Yeah, exactly.
So basically, when people come in, they complain about feeling and looking tired, and often it is about the eye area. And the eye area is a very complex area. It's not just the eye, it's the brows, it's the temple, it's underneath, it's actually also the mid-face can also greatly affect the eye area. So I'd say most people who come in say, you know what, I don't feel tired, but when I look in the mirror, I don't recognize myself, whether it's heavy eyelids, dark circles, puffy lower eyelids, just feeling that, that way. This is the thing everybody wants. Can you make me look like this?
Those 3 fingers that Sherina showed us.
Those 3 fingers. And we don't realize that a lot of things that do change, our bony structures change. We have loss of fat, we have loss of volume, hormonal changes, body fat actually, with changes in pregnancy and weight and just bony structures. They alter and change so greatly. We don't realize that we're losing so much volume here, and that's why everything sort of falls in the middle. And that affects the eyes too. If you've lost volume in your temple, then of course your eyebrows are going to look a little bit more hooded. If you've lost volume in your lower eyelids, of course you're going to look a little bit more gaunt. So it's multifactorial. It's from heavy upper eyelids, puffy lower eyelids, lines and wrinkles, and just that overall tired feeling.
And it's very interesting because I think what you're saying is very similar to what Sherina was saying as well. You know, sometimes it's the structure of the face that is causing these key features to suddenly feel quite under par. But again, you need to speak to a doctor who can explain the changes that are anatomically happening to understand why that is happening.
Absolutely.
And when it comes to the eye area being so susceptible to visible aging, I mean, do you find that things like digital devices, like you know, the environmental factors that we're exposed to now, are they all playing a part as well?
I think everything plays a part. So environmental toxins or pollutants, whether it's, you know, the screen, whether it's more screen time, I think that life now has become very busy. I've even noticed since the pandemic, or even since lockdowns ended, I am crazy busy, and I don't know if I'm not used to being this busy or if it's actually my
what being
life
busy was like.
Yes, and so, but we're all very busy. We lead active, healthy lives. We're looking to live our best life for the longest that we can. Longevity is really very important. But we are also depleting ourselves. So we want to get our workout in. We want to be the good mom, the good, you know, partner. We want to see our friends. We want to do everything. And we think that everybody else is doing it with ease. Because obviously when you have something on social media, no one's going to post their bad day. They're only going to post their excellent days. So you think that everybody's killing it every single day.
And you don't necessarily see the work, or you don't hear about the work that other people are doing.
Absolutely. And so I think there's an unrealistic expectation that you can do everything. I don't think you can do everything all the time. You have to pick and choose. Sometimes, you know, I'm going to be a really good wife, or I'm going to be a really good mom. Sometimes they don't work together. But I do think that there is a lot of environmental factors, particularly being in a busy city life environment, on the go all the time. But I also think that there's a lot of things that happen from lack of rest. You know, sleep is really important.
Agreed.
You know, if you don't allow yourself to regenerate and rejuvenate while you're sleeping, you can't function optimally. Your brain power isn't as good. Your actual physical power isn't as good. And of course, you're going to show it in the face. You're going to appear more sallow. Your skin's going to look a little bit more dehydrated. So, you know, eating and living well means sleeping, having good nutrition, and having some time to exercise every single day. And I think when you do those things, meditation or some sort of, you know, introspection really helps as well. So I always say my exercise is a form of meditation for me, because it's that specific period of time that I keep for myself, and I can't actually do anything else. Like, you know, I can't go on my phone.
Self-care as well, isn't it?
It is self-care.
As much as doing our sort of, you know, evening skincare routines, finding time to meditate, to sleep properly, to eat well, to exercise, like you say.
It's difficult to try and juggle it all. And then as a woman, every time you start something, it's another thing to add to your repertoire. So, you know, I always tell people who are young and they come in, you know, should I do preventative, you know, neurotoxin? And I say, well, if it's not bothering you, don't start it, because once you start, you're going to love the effects. And that's just another thing to add to your maintenance regime with, I don't know, waxing, nails, hair. I mean, like, it can go on and on and on. So I think it's really important to do things as you need them. I think that's something that I would like to emphasize. There are some things you can do for prevention. So obviously lifestyle choices, skincare, and doing little things, tweaks that are not changing the DNA of what you look like, I think are really important. So energy-based treatments, having, you know, a nice medical facial every once in a while. I prefer that than you know, saying and having a lush facial. So it's super nice to do those things if you want to pamper yourself, but if you want to do something that's better for your skin quality and just in terms of your maintenance, I would rather have something more on the clinical side that maybe might not feel as luxurious as that, you know, lovely spa, but you're going to have a longer efficacy and, you know, results from that.
And as an oculoplastic surgeon, I've often heard you say, you know, to exhaust all of the non-surgical options first before you go ahead and have the blepharoplasty, which is really interesting. And why is that your philosophy?
So I think it's very specific to the patient that comes into my office. So I used to say never operate on anybody less than a certain age. And I had a 28-year-old who came in with very significant hooding of the upper eyelids where they were sitting on her eyelashes. And, you know, in that patient, I would say, no, absolutely, you are a surgical candidate. But there are a lot of things we can do. So starting from good skincare, obviously it all starts with that. So if you're coming into my office and doing all these lovely procedures and you're not wearing your sunscreen and you're not wearing your retinol and you're not using, you know, your vitamin C, then, you know, you're not really getting the best that you can get. And it's kind of, you know, you wouldn't go to the gym and exercise once and be like, look at my muscles. You know, it's an ongoing sort of thing. So
yeah.
I think that's actually
that routine and that maintenance.
Absolutely. So when someone comes in, we start off with good skincare, understanding what's happening, the bony changes that are happening, the volume changes that are happening, and then I discuss. So the first thing I ask anybody who comes into my office is, you know, a lot of people say, so what would you do to me? And I say, no. What do you see when you look in the mirror? So what is it that when you look in that mirror that bothers you? Because if I notice, I don't know, a freckle there that you've never noticed before, and all of a sudden I point it out, that's all you're ever going to see. And you're going to do everything to get rid of that freckle that you never noticed before you walked into my office. So I want to help you look the best version of yourself, and you're the one who's going to see yourself on every mirror and every call and every video. And I think it's really important to address those things. So
true.
Whether it's fine lines and wrinkles, people say, oh, you know, when I'm animated, I can see the fine lines and wrinkles. And some of that is cute, and some people are really bothered by it. And that's where something like a neuromodulator, like Botox or Dysport, can be used to temporarily paralyze those muscles that cause dynamic lines. So dynamic lines are the lines that are caused when you're actually using the muscle called the orbicularis around the eye. I also like using that for young patients who might feel that they're starting to feel a little bit heavy on their brow, and you can get a very nice little temporal lift by using neuromodulator. I sometimes even place it medially, so you can actually help open the eye area up. Also with injections that can happen even in the scalp. So there's a lot of little...
to sort of lift the brow a little bit more and give that lifted appearance.
Yes, so I love neuromodulators because you can lift and do so much in different areas of the body, the face, the jowls. And then of course we want to revolumize. So if someone has puffy lower eyelids, well, why do you have puffy lower eyelids? Is it your lymphatics, or is it actually that you have fat herniation? We have 3 fat pads in our lower eyelids, and there is a sheet of tissue that holds that back. It becomes attenuated with time, and sometimes that fat herniates or prolapses forward, causing constant lower eyelid puffiness. Now, obviously genetics has a big impact on that. Wearing contact lenses, someone who has a lot of allergies, eye rubbers. So, you know, there are a lot of things that can actually accelerate having fat herniation in the lower eyelid. Now, if you have just a little bit of fat herniation and, you know, you create this little hill in the upper eyelid, that creates or gives the illusion of a tear trough. So people say, oh my God, I have these dark circles under my eyelids, when in actuality, they're not dark circles, they're shadows. So you have that hill and then you have that valley, and that valley becomes a shadow. So if you can lift the valley or decrease the hill, then you're going to have a nice even skin area, and you will not see dark circles anymore.
And then the light reflects off it, and the eyes just sort of look brighter and lighter. And
yes. So in someone who has a small amount, I can mask that by using something called tear trough filler, which is a dermal hyaluronic acid filler that is injected through certain areas in the lower eyelid to create that smooth appearance. If it's gotten to the point where I can often tell when looking at somebody, I can say, you know, we can try it, but you're probably not going to be 100% happy. And if you're not happy, either you can try it. If it's not enough, then we can progress to surgery. And that's also a way. You know, surgery, people have to have downtime. They need to, they need to be able to not be active.
Yep.
There's some things they can't do in terms of exercise or daily routines, so it takes a little bit of planning to be able to determine whether or not you can actually have surgery. And of course, there's a different cost implication of having surgery versus an injectable treatment that might take 10, 15 minutes in my office. And so I think that's actually really important. Now, the upper eyelids, there's a genetic predisposition, and there are certain eye shapes and contours that are predisposed to having hooding earlier than others. So, in people who have a lot of eyelid show, which is, if you put if you're someone who wears eyeshadow and you can do 5 colors on your upper eyelids, you have a lot of eyelid show. A lot of people do not have that. It's usually a genetic, also ethnic appearance that you might have. And so, with time, those people sometimes become more hollow as opposed to more hooded. And then there are people who, that sexy, like Giselle, the model, that sexy look that you have, but the eyelid is quite hooded, and those people are predisposed to having hooding earlier. And so I really think if something bothers you more days than not, that's my threshold. That's when you do something about it, whether it's surgical or non-surgical. And sometimes you need to have a few things happening all together. So you might have the puffiness, you might have the fine lines, and you might have some skin laxity. And skin laxity in the lower eyelid is a little bit more complex. You can try, of course, with some, neuromodulators, dermal fillers. I now use nucleotides also, which help to help the body kickstart its ability to reinforce and build your own collagen in that delicate eye area without volumizing. And then I have a plethora of energy-based treatments. I love lasers. I have a new laser that I absolutely love for, resurfacing, whether I do it fractionally or fully ablative.
Just keep talking.
Yeah, pause for 1 second.
She goes on for a while otherwise.
Okay.
And so, those laser treatments are really fabulous in terms of being able to promote collagen production. And so someone who wants a less downtime might do a fractional treatment that will be, 3 to 5 days, whereas something more aggressive, like a fully ablative, will take more time to heal, but will give you a faster, better result. So I think it really depends a lot. So that's where the importance of the relationship with the patient also comes in. What can that patient afford in terms of time in having this treatment done? And sometimes I like combining all of them. I do it in a surgical procedure. So I'll do the blepharoplasty, I'll do the laser resurfacing, and then after, once they've healed, we'll reevaluate for neuromodulators, like, Azlor, Botox, Dysport. So I think it's a very holistic approach. Volumization is very important in the area. Temple hollowing is very aging as well. So I think it just depends on what you look like when you come in and what bothers you. People don't often know exactly. They just say, I look tired, what can I do? Yeah. And when they open that and they say, or they do that 3-finger lift, immediately I understand. So I think it's very important to be able to discern, what the problem actually is. And as you were saying, in terms of lymphatics, that's actually very interesting. So people say, I have puffiness in this area. That's not where there's a natural fat pad, and they may have history of having multiple sunburns when they were younger, or having a lot of sun exposure that's predisposed them to having sluggish lymphatics. It's a very difficult thing to treat. Oftentimes they've gone elsewhere and had multiple injections with dermal fillers, which can actually create more stagnation in that area and hold on to more fluid and volume. And so those are more laser or surgical treatments. And so it really depends. Not all eyes are created equal, and there are a lot of reasons that you can have for having that tired appearance. And that's why it's really important to go to someone that you trust, someone who has the expertise, and someone who also has a plethora of options in terms of treatment modalities. So, if I just did surgery, I wouldn't be able to help so many of my patients.
Exactly.
And looking tired doesn't start in your 40s, it starts even in your 20s. And so it's just really important to be able to have the technology and the treatment modalities. So,
and I think that's what's so unique about your approach as well. Like you say, it's the combination of the non-surgical, the surgical, the skincare, the lifestyle, and I think that's something really important to sort of take into consideration when we are approaching these treatments. Maryam, that was fascinating. Thank you so much. And what a great overview on eyes. I know exactly who I need to come and see when the time comes, which is probably quite soon. On next to, final speaker, Dr. Galyna Selezneva, incredible body expert working from the Dr. Rita Rakers Clinic in Knightsbridge, and also a psychiatrist. So I think Galyna brings a really human touch to the treatments that she performs. But Galyna, maybe we can start by exploring, because you see women of all ages and stages of life coming into your treatment room. How are most women feeling about their bodies right now, would you say?
Well, first of all, I just wanted to say that while both panelists were talking, I can relate to everything. I could relate to what Sherina was saying, to what Maryam was saying, to what you're saying, because I'm human, you know? So I'm sure I was looking at the audience and you were all nodding. And one important thing, the changes from the COVID time, pre-COVID time, COVID at now, and I'm sure you're all going to agree with that. We let the work into our home. We've let the work with Zooms. We don't have that barrier anymore. No, there is no barrier. It's very hard to push back now. And a lot of my patients are saying that before they were able to find a little bit time for themselves, and how much more complicated it has become to balance your work, life, exercise, holistic approach, to find in that 30 minutes for the LED treatment, it has become incredibly difficult.
And how is that then making us feel about ourselves physically, that emotional turbulence?
I love the word sluggish, and I think there is a degree of physical sluggishness, but also mental fatigue. It's a lot of things going on. I don't know about your life. In my life, there is a lot of things going on. And the impact that it has on the face, there is such a term, it's called body surface area. And the face takes about, look at your palm. From your wrist to your index finger, that's about 1.5% of your entire body surface area. I'm sorry, ladies, but I'm going to do this. 1.5%, 1.5%. 3% of your body surface is your face.
Oh, God, that's terrifying.
97% is your body. So all the changes that you were talking, and we're talking about the skin, the fat. Unfortunately, fat disappears from here. You know what I'm going to say, yeah? Okay. So there's so much more going on in the body, and unfortunately, we've become acutely aware of it. I used to get selfies from Zara fitting rooms from my patients. You know, the light, the mirror. It's like, the cellulite, what do I do? Now I'm getting a lot more photos from the home, from the mirrors, because we have more time and we become more aware. So the self-awareness that the body exists is there. And I forgot what, sorry, I get so passionate talking about.
It's fascinating listening to you. I mean, what are I'll ask you the same question I asked Maryam and Sherina. What are those key milestones, again, that are enforcing this sort of feeling?
So the milestone, oh God, hormones, again, to what Sherina was talking. Always. First of all, we develop in our body, so that's the 20s, and we are now living in the world of social media and the filters and the impossible beauty standards that are being portrayed. I am a strong supporter that Instagram should make the hashtag filtered, edited mandatory, as the same way they've done it with ad for the influencers. So that should be made mandatory, because impossible social standards are almost pressed on us. Secondly, we have we actually have much more milestones in our lives.
That's so true.
Before it was, I grow up, I have a baby, I get old. We are socially fit for so much longer. So I am now seeing, I actually don't see a lot of younger girls. I'm not into beautification. I am more about I'm pro-aging, I'm pro-healthy.
You're the longevity sort of expert when it comes to your devices.
I am seeing a lot more lovely patients in their 40s, 50s, 60s, 70s, 80s. And the treatments like EM Sculpt Neo that Sherina was talking about has revolutionized the approach to the body. It's no longer about what we look like, but it's also functional. For the first time, as an aesthetic doctor, I can say that I'm going to offer you a treatment that no longer, not just going to take away a little bit of fat, it's not just going to make your skin tighter, but it's going to also make your muscle stronger. You're going to have a more functioning, better functioning muscle.
And I love that, because it's like we've snapped out of that culture of we must be skinny to we must be strong, and we must be bulletproof for the years to come.
And healthy.
Absolutely.
One thing that COVID has showed us, it doesn't matter what you do, you have to be healthy. It doesn't matter how much money you have to be healthy.
So true.
It doesn't matter where you're going to go on holidays, you have to be healthy, because you're not going to go on holidays if you have COVID, isn't it? You know, the traveling.
That's the irony nowadays.
So health has become a priority. And as doctors, we're incredibly happy about it, because now the patient comes in and it's no longer, I have a patient in his 80s, he says early 80s. I suspect, you know, we're talking late 80s.
Yeah.
He has done EM Sculpt, which is a muscle tightening, muscle toning treatment on every single part of his body. He's not interested in the aesthetic results. He's interested in his posture. He's interested in his abdominal core muscles. He's interested in his health.
I think posture is really important actually with the EM Sculpt Neo.
I have a very famous plastic surgeon who comes to the clinic to do EM Sculpt Neo purely for her abdominal muscles, because it gives her better control of her posture during the surgery.
And then you eliminate the back pain at the same
Absolutely,
time.
lower back pain. You surgeons, you will agree with me, standing in that position is quite, well, actually, I don't know, I'm not a surgeon, but it's incredibly pressure, you know, incredible pressure on your lower abdomen and lower back pain. So having a stronger core is important. Simple as that. And of course, you know, who doesn't want a little bit of that fat pad, which is stubborn, because none of my treatments or none of our treatments is a substitute for a healthy lifestyle. We do not suddenly give you permission to eat cakes all day, or we do not, you know, just, oh yeah, don't go to the gym, it's fine, I'm just going to freeze your fat. That doesn't happen. As a patient, actually one of the great questions that patients are more interested now is the longevity of the treatment. And
That's
this
really
is
good.
Us as doctors able to say, boom, back to you. You are the one who's going to determine the longevity of your treatment. Whether it is with skincare and having good sun protection after you've had your skin treatments, same with body. You know, I can perform the treatment, the rest is to you.
And actually they do say that sometimes, you know, going to the gym can actually enhance the effects of the EM Sculpt Neo, for example, or the fat freezing, obviously the eating healthily.
Absolutely. For example, if you're talking about EM Sculpt Neo, it is a supramaximal contraction. It is nothing that you are able to ever achieve at the gym personally, but your muscle has a memory. It's actually called, Victoria, you would agree with me, it's called muscle memory. Once your muscle learns how to exercise at a much higher level, you have completely changed the game. So your input and our muscle output is completely different. So every time you go to the gym, you are able to perform at a higher level.
And tell me about, because you also offer an amazing plethora of female-focused devices for, because as you're about to say, I'm sure, aging doesn't stop with the face and the body, it goes everywhere.
Internally as well. And dry vagina is the thing, and I'm so happy that I can say that, because we are now in 2022. But the number of women that I see that suffer from painful intercourse because of vaginal dryness, and they think it's normal. So now I've been doing vaginal rejuvenation for about 5-6 years now, and before I wasn't even able to ask at a conference, one of those boring conferences for the doctors, it wasn't even a thing. So to have now an ability to combine vaginal rejuvenation with a micellar chair for pelvic floor tightening, so I can give a much longer, let's say, social life to my patients, or dating, or, you know, enjoyable intercourse, that makes me happy.
At any age as well, because like you said, we are living longer. These milestones are becoming sort of later in life sometimes. 70 is the new 60, whatever
70s
we
is
might
the new
say
60s.
nowadays.
I have a patient coming from Scotland to see me once every 3 months, and we have a nice little face laser and we have a nice little vaginal laser. So she continues to live her life, and I love that.
Yeah. And tell me, because a lot of the treatments that you do are obviously also restoring the patient's self-esteem. And you are a psychiatrist by sort of your training as well. So at what point does the patient's mental health come into the conversation? Is it part of the conversation? Does
At
it
the
have
time
to
you
be?
open the door.
Okay.
At the time you say hello, it is incredibly easy to say yes to the treatment, isn't it? But to say no and to consider all the aspects. Nobody has ever come to, we are aesthetic doctors, nobody has ever come to see us for a wrinkle. Never. It is the story behind the wrinkle. In the body, nobody has ever come to see me for a bit of a fat pad. The single question that you can ask your patient, why now? Why are you looking for the answer to your concern now? Will give you a very good understanding why the patient, what's happening in their life, how can we help? And this is what Sherina was talking about. There's a holistic approach that we need to understand. And I have 10 years in mental health, will probably make you a bit mental, which is absolutely fine, but it will also give you a great insight. And I have worked with the I call it hardcore psychiatry. I worked with eating disorders, with addictions, with forensic psychiatry. So I've seen the end result of body dysmorphia. So I am incredibly tuned into mental health and mental, or let's say psychological well-being of my patients. Yeah. So patients come in with the palaver of problems, and you have to consider all of them.
Yeah, and where do you see as a practitioner the greatest quality of life coming from when it comes to patients and the procedures you might be offering them? It's a tricky one.
I personally review all my body patients at 6 weeks and then at 12 weeks. And when I have a mother, and I, haven't been with Dr. Akers for 10 years now, when I have a mother bringing her child, I mean 25, 26, 28, bringing her daughter or bringing her mother to the clinic to have something done, and Dr. Akers has generations of patients coming in, that is a beautiful feedback personally for me.
Exactly.
So
I think that longevity of treatment and seeing it go through the ages, and no, that must be wonderful. Thank you so much, Galena. That was super interesting. And I think we've probably slightly gone over time, so my apologies. I can see Shannon. We've been keeping a very close eye on our clock down there. But thank you everyone so much for coming. I mean, it's been wonderful for me, and I'm sure hopefully it's been the same for you, but to listen to these three wonderful women talk about the treatments that they do. And I think it really does emphasize, that these treatments go so much deeper than the surface. This is more about skin and fat and muscle. This is about how we feel about ourselves as human beings. And that's why I think this industry is so wonderful. And I hope when you wander around here today and see all of the amazing things on offer that you'll agree with me. Sadly, I don't think we're going to have time for a Q&A, otherwise I'll get shot. But these amazing women will be here. I'm sure they'll be delighted just to answer a few quick questions that you might have. And then anyone, please do come up. If you've been at the talk, do come up to stand G1 and grab your Beauty Triangle goodie bag. Lots of treats in there. And sign up to our mailing list. We'd love to have you at all of our events. They happen every month in London. Always a very interesting, I hope, holistic conversation, and we'd love to have you be a part of it. So thank you for being here this morning, and thank you to our amazing TVT panel.
Thank you so much, Francesca, Sherina, and Maryam, and Galena. That was so fascinating, and it is so important, all of the things that you were talking about patient safety, and that it is really, aesthetics isn't what you just see from the outside, it's how it makes you feel on the inside as well, and the wellness that it brings. So that's a very important message. Thank you.